Hello, it's Robert here, and to help people who are scared of various things with fact-checking and my science blogging. And this is to explain people who are scared about the beach close downs and the other ways, temporary lockdowns on July the 4th. All sorts of conspiracy theories spreading. It's very, very simple why they're doing it. This is what the public did on Memorial Day. And there's a lot of other, you can just click through the video here, and there's lots of people who are just not doing any physical distancing, and that basically is the problem. So you have two possibilities: that the public do the physical distancing, they wash their hands thoroughly, and they don't touch eyes, nose and mouth, or they all have to be locked down. A lockdown is what you'd have to do if the people don't do the physical distancing. In other words, the government do it for you. And it's not hard. You don't even need to stay a metre away all the time. You need to stay a metre away when you're talking to someone face to face. If you're laughing and shouting face to face, then stay at least a metre away. And then wash your hands thoroughly and don't touch your eyes, nose and mouth. It's not a hard thing to do. And then if you absolutely have to, but not in a situation on the beach where you can step away, but if you absolutely have to, then you wear your masks as well. And be careful, don't touch the front of the mask ever. Adjust it from the back of your ears, wash it thoroughly with hot water when you get back at the end of the day for the next day. And the mask is to protect others. You can't protect yourself, even if you do it very carefully without a visor for your eyes as well, because it comes in via your eyes. The mask is not to protect you. And in healthcare settings, then doctors and nurses do use clinical masks for self-protection, but they are very careful. They know what they're doing. They know when to use which kind of mask and how exactly to use it, and what they're protecting themselves against. I don't think this is the public's fault. It's more that the authorities can't be explaining it clearly enough. It should be like clunk-click for advertising for cars. The same as you put out on it, you wear a safety belt when you're in the car. You should have constant ads explaining this until people get the message. If they did that, I don't think people would do this, because they would understand that they're endangering their parents and their grandparents and others that they care for. What they don't realise is that as a result of all this, then a couple of weeks down the road, not straight away, because it's very deceptive. In fact, it typically takes 5 days to, or half of them show symptoms within 5 days, the other half later. And then the symptoms start off very mild for the first week, so you hardly realise you've got it. So it's easily going to be 2 weeks or 3 weeks until you start having lots of people in hospital as a result, and then 3 weeks to 4 weeks when you start having people dying as a result of what they did. And then it's the ones who are most vulnerable are not the young things who are mainly the ones out doing this stuff, but their parents and their grandparents and other elderly people they may care for. And not necessarily through them directly, but they could infect someone. They could infect someone else's grandparents, and someone else infects your grandparents. It just goes all around if you're spreading it through the community. And then others who survive, they may have to go on the ventilator, which means that at a certain point a doctor comes to you and says, it's too bad, we can't let you just continue on to oxygen, we have to do mechanical ventilation. They then put you under as if it was for an operation, but you then come out of what like being in an operation, but you come out 6 or 7 weeks later, and you don't realise any time has passed. And during all that time, every single breath you have taken has been the result of someone monitoring a machine and making sure that it keeps inflating your lungs. And if anything ever went wrong with that machine, then you die. So that is, and then once you get up, once you're out of it, then you have to deal with you need oxygen for a while, and then you spend a long time in recovering. So the point is, this doesn't need to happen at all. Do the protection, do the physical distancing, and you're protecting yourself from this, and you're protecting others from this, the people who could be infected going through you. So that is the important point, not to focus on all the deaths and people on ventilators, but focus on that this can be stopped. It can totally be stopped. We know how to do it. We have 4 ways to do this. First of all, we did discover, and the UK was first to discover this, that just a lockdown on its own, without anything else, does slow the virus down and reduce the cases per day. So that's why, if the public won't do what you're saying, then a lockdown will cause it to come down, as long as it's strictly enforced. And the public then do respond to lockdowns. They do as they're told, to a fair extent. It's just that it's not that the public are not compliant, really to some extent, sometimes they do, but it's a minority. It's mainly that it's not been explained to them clearly enough, and they just get distracted and forget, or they just don't think it's important, they don't understand. And so once you start letting them go on the beach, it's very hard for them to remember that you should do the physical distancing. So it's easier for them to remember if you say something simple like never leave your house, except for shopping and limit it to an hour a day and so whatever they say. So it's basically because the public are not doing the right things. So the public can stop it by themselves as well. If everyone was as careful as the WHO epidemiologists, then they go out to places that are hotspots of COVID-19, and then they come back, they don't get COVID-19. We have these supposed experts in the United Kingdom who did get it, but they can't have been taking the right precautions. They thought it was like flu. They didn't seem to, you saw them just not taking it seriously, and just not taking the right precautions. If you take the right precautions, you can protect yourself. And so if all the public worldwide did that, that's one way to stop it. I mentioned the lockdown is another way to stop it, just that by itself, if it's strictly enforced. And the other way to stop it, the third way, is test, trace, isolate, which that by itself can stop it if you do it very, very thoroughly. Test everyone who's got flu-like symptoms, and that's called active surveillance. So you actively test not just people who've got a travel history, but everyone in your community who has flu-like symptoms, who has COVID-19 symptoms, including the new ones, such as losing your sense of taste and smell. Then test everyone who's like that, and then trace immediately as soon as you find a case, trace the contacts, and then you can get to the contacts. Remember I said it's got a long incubation period and then very, very slow startup. It's infectious just towards the end of the incubation period, and then it's infectious for much longer than flu, for 10 days to a fortnight, even for mild cases. So if you find someone who has just got it, then they were infectious maybe for the last couple of days before, and it could be up to 4 or 5 days if you're catching them, but they start this a couple of days before they started symptoms, then you probably get to them a few days after they started symptoms when you find them. Then many of their contacts won't actually have developed symptoms yet, so you can go and find them before they've got the symptoms, and that's what the isolation is about. So they can't infect anyone in the pre-symptomatic state. And then even if they've got symptoms, then it takes quite a long time before they get tested. So you've got all that long period, which could be a week or more, of infectiousness, and it may be the most infectious period. and you can stop that. That's why tracing works. And then the final method of doing it, the fourth method of doing it, is to test everyone. And this is most often done in a care home or a hospital. And you test everyone, symptomatic or asymptomatic. And then if you keep doing that regularly every few days, then that's actually better than contact tracing. So, you could, there's no reason why you can't do all four. So you do test, trace, isolate, you do targeted lockdowns. So you don't need to lock down everywhere. The only reason they locked down the entire United States is because they had done hardly any tests, so they didn't know where it is. So then that's where I'm going to finish this. So this is like looking at Virginia, and you can look most of it than no cases or few or no cases for 2 weeks. And others have declining cases. So Virginia is pretty much steady at the moment, but still you want it to go down. You don't want to go steady, you want it to go down. So if they can't stop it by test, trace, isolate, if they still have to ramp that up a bit more, maybe the tracing is not being very effective, maybe they need more public messaging to make it work, and they need to train their tracers to work better. Maybe they need to do a bit more testing, although Virginia is pretty good in both those respects. But it's obviously not quite doing enough, or it would be going down like it did in New Zealand. Everyone can do what New Zealand did. So another thing you can do is do targeted lockdowns. So you would need to lock down Buttigieg County, or whatever it's called. See, it's gone up from 1 case a day to 7.7 a day in 14 days. And then if you allow that to keep going, you'll have 50 a day 2 weeks from now in that place. So that is if it is going. It could just be, but something like that could just be a super spreader event. You see, it's just a blip up towards the end of the graph. So it could be just a super spreader event, and then it's over. But if it's possibly community spreading, then you could do a target lockdown, and maybe even a zip code within that county, where you find out that that's particular zip codes where it's spreading, and you need to lock it down. So that's a targeted lockdown. So you can do targeted lockdowns. It's unlikely you have to lock down everywhere. You can do specific measures like close beaches or close pubs, places where you know the super spreader events often happen. We know historically that in places that a big super spreader event happened in the après-ski parties in the chalets. That was most of the German outbreak originally started from that. So you know this disease is mainly spread by super spreader events. Most people don't pass it on to anyone, and then so 1 in 10 or so will pass it on to 20 in a big super spreader event, like a party. So that's why it's so important not to do these partying close up. How tempting it is, but then if you are unlucky enough that one of the people in your party has COVID-19, then it could be 20 people have it at the end of the party. So one person goes into the party with COVID-19, 20 people go away from the party with COVID-19. That's what can happen. It doesn't happen if you're just sitting next to each other on a bench or walking together side by side and not turning and talking to each other. It's specifically face by face is when, and of course when you're walking you do tend to turn and talk, but if you were to resolutely walk side by side, both looking forward, then the droplets just come down in front of you, and they're not going to infect the other person because they go down very quickly and touch the ground. So it's looking face to face, and especially for a long period of time. And the more sustained it is, then generally it's not a certainty that if you have very little stuff, you get a weaker form of the disease. But if you have sustained they say 15 minutes is you would count as a contact. If you're within 1 meter, talking face to face for 15 minutes, you definitely can't contact with a significant, though still quite low risk of getting COVID-19. But if a lot of you are together in a party and you're close up, or close to COVID-19 and laughing and shouting and singing and things, then it seems that's the ideal situation, and you end up with lots of people with it. So that's why they're doing lockdowns, and that's why they're shutting down the beaches and closing pubs. There's nothing sinister about it. It is a very sensible public health measure, and the reason they're doing it is because the public are not complying. So you can do your part by complying and just following these very basic, simple measures that have probably been explained to you over and over again. And with wash your hands, do it very thoroughly. You've got to wash every part of it. If you haven't done it before, then do watch the Dr. Tedros video or any of the other videos. I'll put a link to how to protect yourself at the post I did, which links to lots of other articles about it, where you can learn how to do it properly. And so if you do that, then you protect yourself, you're protecting others. Remember, the distinguished epidemiologists that lead the WHO and part of their team, they go all around the world. They go straight into the worst hotspots of all diseases, like Ebola and COVID-19. They're there in the front line, but they know how to be safe. And so if you are as careful as them, if you aren't careful like they do, then you won't get it either. If you're as careful as the WHO, you can go to a place where everyone's got lots of people got Ebola, and you'll be safe too, because you do the right things. So the particular instructions for each disease, and for COVID-19, it's not the same instructions for SARS, it's not the same instructions for MERS, it's not the same instructions for flu, or measles or any other disease. These are specific instructions for COVID-19 that you've been told over and over again, and that's what you have to do. And that's how to protect yourself and how to protect everyone, including your parents and your grandparents and everyone that you care for, and make sure that they know what to do too. And but don't freak out if you do get a brief contact of some sort, and you touch your eyes, nose and mouth, but you sort of forgot, then it's not likely you get it, because it seems to need a very heavy load, unless someone kind of coughs directly in your face from close up, or there's spit in your eyes or nose and mouth. Unless it's something like that, a kind of big amount, then chances are you didn't get it, even if you had a bit of a breach of it. And also, if you get just a small amount gets to you, then most likely you get the mild version of the disease. That's quite common with these coronaviruses, that a small amount, and I think with other viruses too, but the WHO say that's quite common, that a small amount, if you get a small amount initially when you're first infected, you tend to have a milder response to it. I suppose the body gets off to a quicker start, an easier start, got less to fight at the beginning of the disease. Anyway, so I'll stop that now and upload it, and hopefully this helps some of you. Just very basic, it's nothing at all to do with anything else, it's just this. Just basic public health. And we can stop it, and we can stop it worldwide. Every country, we've seen it, every country, every ideology, every political system, every religious system, everyone can stop this virus. You don't have to be an island, you don't have to be a country, a rural countryside area. You can be a city, you can be anything. Everywhere in the world can stop this. It's particularly hard in refugee camps, but most of you are not in refugee camps. It's very hard for them to find enough water to wash their hands and to do the physical distancing when they're so crowded. And so there's special care to try to keep it out of the refugee camps. But even there, they're doing their they're making their cloth masks and doing the best they can to try and protect themselves and keep it away. And also, when you're not just you yourself in your country. There's so much connection with the rest of the world, even with the travel restrictions, that by stopping its spread in the United States, you are helping, it's a sheep looking in my window, you are helping the entire world stop the transmission in Virginia, and you stop the transmission chain that, as far as you know, could have gone from one person to another through the United States, could have ended up in a refugee camp in Africa after many, many jumps. So we owe it not just for our own countries, but for the entire world. China had a very, very strong feeling of that in the early days, and I think the rest of the world should take this same approach, that we need to do this for our own country, we need to do this for the entire world, especially the most unfortunate people who don't have access to water to wash their hands, who know they should wash their hands, who know they should do physical distancing, but it's just impossible for them to do it, and they're doing their best to try and stop it with these fabric masks, which they make themselves. But they can't wash their masks very easily either. So, you have it so much better in the United States than these people trying to stop it in refugee camps. Anyway, so so I was hearing about refugee camps. There was in the WHO press briefing yesterday, someone from was speaking from Middle East and Africa and was talking about the issues of refugee camps. So it's on the top of my mind just now. Anyway, so I'll stop this now and upload it.